Okay, well, good morning and welcome to South Australia's David COVID-19 update. Today I'm joined by Stephen Wade, the Minister for Health and Wellbeing, Professor Nicola Spurrier, who is the Chief Public Health Officer in South Australia, and Commissioner Grant Stevens, who is also State Coordinator during this major emergency declaration. This has been a very challenging time for the people of South Australia dealing with this Parafield cluster, and I want to thank every single person in this state for the outstanding effort and contribution they've made to helping us get on top of this cluster. Yesterday we had a very high testing result with 12,322 people going off to get themselves tested. That is almost 100,000 people in the past 7 days. So a massive thank you to the people of South Australia. I know that this is really a combined effort to do every single plausible thing we can to get back to a sense of normality by Christmas this year. The Transition Committee met this morning and a number of decisions have been made, and they track a pathway back to that normal situation by Christmas. The first thing that I can announce is that the border restrictions which have existed with Victoria will be completely lifted as of midnight on Monday night next week. So from the 1st of December, we will completely normalise our border arrangements with Victoria, and I know that this will be a huge relief for many people who have been adversely affected by these border restrictions. Secondly, I can announce a series of changes to restrictions that will be in place for a 2-week period from next Tuesday. And these chart our course back to where we want to be by Christmas. Firstly, I can announce that the patron caps on all general trade in licensed premises will be removed on Tuesday. And this is conditional, of course, on individual licensed premises deploying the QR reader technology on their site. Secondly, the density of 1 per 4 square metres will remain for all indoor activity, but we will resume the arrangements for 1 per 2 square metres outdoors. So indoors will be 1 per 4 square metres with seated consumption. Outdoors will resume the 1 per 2 square metres which allows for stand-up consumption. Caps will remain for private functions, and there are some changes. We increase the cap for funerals up to 150. We increase the cap for private functions up to 150, and again these private functions in licensed premises will allow stand-up consumption. For weddings, we keep the cap at 150, but we allow for dancing and also for stand-up consumption from Tuesday next week onwards. Home gatherings will remain at 10 persons. Gatherings over 1,000 and nightclubs will require a COVID management plan approved by SA Health. Community sport will resume from Tuesday next week, but we will be working with sport associations on a modified program of fixtures so that we can minimise the chance of infection and transmission. And finally, masks will be required when you can't maintain that 1.5 metres worth of physical distancing, especially in areas personal care services, allied health and residential care facilities. I can also announce that I have written to the Prime Minister requesting that the current suspension of all international passenger arrivals into Adelaide be extended for a further week through to Monday the 7th of December. This means that South Australia will not be receiving international arrivals until the 7th of December. I reiterate that we are 100% committed to the National Repatriation Program and getting Australians citizens back home safely, and we'll continue to work with the Commonwealth on a staged resumption of that mission. I'll now pass over to Professor Nicola Spurrier for the daily update.
Thank you and good morning. I have very good news for South Australians, as well as what the Premier has said. I can report that we have no new cases in our state today, so very good news. A little bit of a recap of where we're up to with the Parafield cluster. So we have 31 cases linked to the cluster. One woman unfortunately remains in hospital, but I've been told that she is stable. Now around 5,000 close contacts or contacts of contacts are in quarantine directly linked to this cluster. And I want to thank every single one of those 5,000 people for absolutely following our instructions and keeping the rest of South Australia safe. In terms of our cases, we now have 23 active cases, so that is a reduction. Because we do know that in this particular cluster, many people have had fairly low amount of symptoms, and some people have had no symptoms whatsoever. So we take it from 10 days from the onset of symptoms to being free of symptoms at that 10-day period, and then we say that that person has recovered. So that's why the number of active cases has dropped, and that is also very good news for us here in SA. So there's 559 total cases of COVID that we've had in South Australia. An amazing 12,322 tests done yesterday. Again, an amazingly high number. And thank you to every South Australian who went and got tested yesterday. I know it's been hot, and hopefully what we've put in place to make it more comfortable for people to go and get tested has made that process for you okay. But that means for me that we are getting as many people with respiratory symptoms tested as possible in our community. I also received some survey data from the South Australian public, and we've been doing this survey for quite some time. And we ask how many people have had acute respiratory symptoms, so symptoms of COVID-19 on that day or in the past week. And one of the things that have been concerning us was that only a small percentage, maybe only 10 to 13% of those people over time had been getting tested, but that has significantly increased, and I'm very pleased to have seen that in that survey. So please keep it up. It's the one thing that every South Australian needs to do in the coming weeks, is if you have even mild respiratory symptoms, go and get tested. If you've already had a test, and as a couple of weeks later you start to feel unwell again, go and get another test. Just because you've had one a week or so back doesn't mean if you get new symptoms you shouldn't have another test. We also have some new locations that we updated last night. And these latest locations, you do not need to quarantine, but you do need to get tested. And these are two large shopping centres in the western suburbs. So the Kilkenny Arndale Shopping Centre, from Sunday the 22nd of November, 11 a.m. till 11:30 a.m. and then Sunday the 15th of November from 11:30 a.m. till 12:30 p.m. So very specific times, and so please think back, look in your calendar, see what you were doing on those days. The other shopping centre is Port Adelaide Plaza. So anyone in that vicinity, Sunday the 15th of November, 3 p.m. to 3:30 p.m. and Friday the 13th of November, 6:40 p.m. So very specific, 6:40 p.m. to 9:30 p.m. Now those are dates that are some time ago, a couple of weeks ago. So you may need, if you do live in those areas, to think really carefully about whether you may have been at those places. If in doubt and you get respiratory symptoms, of course you're going to get tested anyway. Now a little note about masks today, and you can see I've got my cloth mask. It is very important for us in South Australia at the moment, and even that we're looking at changing our restrictions next week, that we all need to be wearing a mask when we're out and about and in close physical contact with other people. So 1.5 metres, if you're not sure how far that is, get a measuring tape out and have a look for yourself. It's actually quite a distance. And I do see many times when I'm walking around the shops that people are fairly close to each other and closer than that distance. It's Black Friday. We've got shops with sales on, and not to tell you not to go out to do the retail, but go wearing your mask. And we have been able to provide through SA Health a large number of masks in our shopping areas, so our shopping precincts in Rundle Mall, and also of course in our other shopping centres. So as I've said this week, you might feel a little bit silly because you haven't worn a mask before. You'll have instructions when you get your pack of free masks about how to wear it, and just remember, when you're wearing it, you're not only protecting yourself, but you're protecting your family, but you are protecting the whole community. So that's what I have to update people on today, but I'm very happy to take questions.
Are you satisfied that the Woodville High incident, that has been contained? There's not going to be any more cases? We're still looking into that.
Look, we still always need to remember that this incubation cycle can be anywhere from 24 hours up to 2 weeks. And so from my perspective, we've got on top of that fairly quickly. We've got hold of everybody that needs to do the quarantine, and we've done a risk assessment about how the infectiousness risk for that school community. So I'm quite comfortable about the actions that have been put in place. Of course, I just can't predict the future.
Professor, can you provide us a little bit more detail why you have recommended venues remain at 1 per 4 square metres inside, while they can be 1 per 2 square metres for patrons outside?
Yes, absolutely. So what we know about this virus is the droplets tend to concentrate when you are inside, and particularly if the ventilation is poor, and we've got very, very good evidence for that. In fact, probably even our most recent evidence where we know that a security guard's been infected just by simply sitting in a hallway where there's likely to have been droplets and possibly aerosol concentrating. So indoors is much more of a risk. So when you outdoors and you've especially got a bit of a breeze, those droplets tend to dissipate and are not so likely to get onto other people, and that's why we've made a difference between that density requirement. Other states have also gone the same way.
Professor, can I just please clarify the advice given to the locations? Is it that people should monitor their symptoms and get tested, or do they need to go into quarantine and get tested? What's the actual health advice on those locations?
So for these locations, and again this is based on an individual risk assessment for those locations, you do not need to self-quarantine, but you do need to monitor for symptoms and get tested if any appear, even if they're really, really mild.
So you're not telling them that they must go get a test, it's only if they develop symptoms?
It's if they develop symptoms, but I must stress it is very, very mild symptoms. So just feeling a little bit down, a bit tired, got a slightly itchy nose, scratchy throat, anything like that, bit of a headache even, bit of an upset tummy, anything at all, and you have been in those locations, please get tested.
In regard to these locations for the girl at the centre of the Woodville High cluster, do you believe the contact tracing is finished? Do you believe that it's just these 2 locations that were visited, a week apart, but do you think that's the end of it, or are your team still working round the clock to see where else she may have been?
I'm fairly confident for the time being, but what I will stress is with all of our close contacts, and indeed our contacts of close contacts, we often go back and do some re-interviewing because we have a way of trying to streamline this process, and this is something we've introduced as part of our supercharged contact tracing. So when we have large case numbers, and people might think, oh, we haven't really had that high number of cases, but we've actually had a huge number of close contacts, and what we do is a very quick interview to start with. So anyone that's been involved as a close contact will know this. Do a very quick interview to find out who are your close contacts and do you work in a high risk occupation, and then we give them information about how to quarantine and get tested, and then we go back and re-interview them. So that process can be ongoing. What I will say is we will be updating our website as soon as we have more information, so it should be a daily or twice daily check to our website for everybody in South Australia.
So we keep talking about masks and how important they are, especially Black Friday sales, these types of events. Have you given much thought to making them mandatory in shopping centres beyond just aged care, beauty therapy, those types of things?
Yeah, so I've certainly gone through the list to see which areas might be better to be mandated and which areas are not. One of the things, as soon as you mandate something such as wearing masks, then we need to be enforcing it. And of course, we're working closely with SAPOL on all of these sorts of issues. And it could be very difficult for us in South Australia, where people are not used to wearing masks, to be enforcing it and saying, well, you haven't got your mask on, here you go, here's a fine. And also, my feeling is with the South Australian community is once we give them advice, they're pretty sensible and they tend to pick it up quite quickly. One thing I've noticed this week being out in Rundle Mall is there's perhaps not as many people wearing masks as what I would like, but one of the things that has been really has struck me is that the retail outlets themselves now have their workers wearing masks, and of course those people are coming into contact with a lot more people.
Professor, just on the Medi hotels, I know yesterday you said you didn't quite have an update in terms of how we think the virus has gotten out. One, do you have an update today? And two, how closely are you looking at the risk of aerosol spread from, I suppose, a scientific perspective?
So I don't have the full report. I'm still awaiting that, and as soon as I do, I'm very happy to share it, and I'm actually very keen to share it not just in South Australia but nationally, because it's important that we all have the best information. We are looking at the ventilation, particularly in the corridors where our security guards are situated, and we know that that COVID is mostly droplet spread, but you can also have smaller droplets and become an aerosol, and those that combination can become concentrated if the ventilation is poor. So we've certainly got our scientific experts looking at that as well.
Are you worried at all about the potential of, and this is purely hypothetical, the potential of the virus maybe having spread in air conditioning systems? Obviously a hotel, sometimes they aren't very well ventilated in some areas. Is that coming into your investigation?
I'm not so worried about the air conditioning. It's more about the ventilation and the movement and refreshing of air in the corridors. We're looking at alternative ways of having security and having CCTV footage just to try and minimise the amount of exposure that our security and other staff have in those particular areas.
Professor, can I just ask you please about testing resources in the Woodville area? There's been some calls this morning from community leaders and the local MP about mobile testing for students that don't and families that don't have access to public transport, and as well as local testing clinics for that will accept testing for children. Can you give any update about what may or may not be happening in that area, please?
Yes, so the testing for children is very important because we don't want families to have to try and travel into the women's and children's, and I am aware that many people don't have a car and can't access public transport, especially when it's so hot. So the Queen Elizabeth Clinic has opened up to children. They've got staff helping them from the women's and children's, and my understanding is they've extended their opening hours, plus they have just changed where their clinic is based so that it's much cooler for people. So again, check the website in that regard. The Showgrounds clinic is opened up, and again that is air conditioned, but again it's not so easily accessible as you've said for some families. So we're looking at absolutely everything that we can do to have facilities close at hand for families in that area.
With this Woodville High student, are you looking at whether she did contract the virus from the pizza box, as was a concern in the previous case, or do you believe that it was from one of the people who was infectious in working at the venue?
Look, it's really impossible to tell unless we had detailed CCTV footage where we knew where everybody was standing and we could make an assessment of that. So that's not going to be something that's going to be possible to answer.
So you haven't ruled out that she could have picked it up off the box?
Well, as I said before, there's different ways that this virus can be transmitted, and it may be it's a combination. So we know that it's through droplets is in the vast majority, but we have very clear examples of where you can transmit it by surface to surface contact. What we won't be able to say is uncategorically it was X or Y.
Yesterday you were saying that you were working out how infectious she may have been while she was at school. Are you any closer to determining that?
So on our risk assessment, instead of having the whole school go into quarantine, the decision has been made just for her year level, and again that was taking into account the information that we had at hand.
Professor, you've updated us on the restriction situation. What's your advice to people with regards to working from home from next Tuesday? Should people be starting to return to the offices in the city as well?
This is really a period of high alert for us as we come out of this. It's over this week, and this has been, you know, a tough week, but it's over the next couple of weeks because we know about the incubation period of this virus. And yes, my recommendation is if you can work from home, my preference is that you continue to work from home for those 2 weeks.
Professor, can I just...
Consideration of the ventilation in hotels, is that something you've only recently started investigating?
It's been particularly important for us as we've actually had this issue. Of course, up until now, we haven't had that issue. So yes, this is something that we're really turning our minds to, and it's important because if we're planning alternatives, we've got to make sure that the ventilation is obviously going to be as good as it can be. I think what we probably hadn't appreciated was the amount or the potential for droplets to come from a room and then concentrate outside the room.
Professor, could I just return back to Woodville, if I may? Can you provide any update about why this student was not in quarantine when she was supposed to, and your very, very clear advice was for anyone who'd been at the pizza shop to, at particular dates, to go into quarantine?
So I answered that question in detail yesterday, Andrew, and I don't have any further information. But just to really reiterate that as far as I'm aware, this young person, and I stress, this is a young person, did everything right. She had, you know, we can't make assumptions about what information people have. She followed what she believed to be the right information, and I have really nothing further to add to that question.
In regards to home gatherings, why are you still recommending just 10 people at home when we've lifted caps on so many other areas?
That's a good question. So the reason for having still that rule about the 10 per person, obviously our experience with this virus in our setting at this point in time in South Australia, we had almost 100% hit rate of transmission in the large family group that where we found the virus in the first place back then on the 14th, 15th of November. So I know that this can be quite difficult for people, particularly going into Christmas, but we will definitely be reviewing this once we get closer to Christmas Day.
If events over 1,000 people need new plans, what's the situation with the plan for the Adelaide Oval and the Adelaide Test? Do they have to resubmit and rethink their plans, or are they going to be okay?
Look, the Adelaide Oval have been great people to work with. We've been working with them all through this pandemic, and so my team and I will be continuing to look and tweaking and putting in whatever risk mitigations necessary
But they will need
for
to
that.
resubmit a new plan?
No, so they already have a plan, and as we've had more information or things have changed, we've made alterations, and so we'll continue to work with the Adelaide Oval management on that.
Professor, what's the latest with the decision making around moving to the dedicated medical quarantine facility? We know that police have been definitely at the Wakefield, and we also know College Grove and the Repat were in the mix. Have you decided on what the venue is going to be for this facility going forward? Is it going to be the Wakefield, former Wakefield Hospital?
So my information is that no decision has yet been made, but I'm very happy to pass over to the Health Minister to provide further information.
Professor, just before you go, you earlier in the week said that the champagne was on ice. It hadn't been popped yet. Do you anticipate to pop that cork on Tuesday?
I think I will keep it on ice just a little bit longer. You know, it's always nice to have that sense of anticipation.
Just one more question, Professor. Just on the Medi Hotel Peppers, have you finished testing all of the staff members, and if so, can you guarantee that the people staying at Peppers will not have to repeat their quarantine stay?
Yes, so I had an updated spreadsheet last night, and I've got a letter that we've drafted to go to all of the people at Peppers Hotel, but because I've been doing media and also the transition committee meeting this morning, I haven't had a chance to get to that.
And a bit of number coming out of...
Is it fair to say you're looking more closely now at aerosol spread as opposed to that surface transmission, or all of these things?
No, that wouldn't be an accurate statement. No, we're just looking at all of it. We know that droplet spread is the most common form of spread for COVID-19.
I've just got to talk to the Commissioner if you don't mind.
Thank you.
Briefly. So, Commissioner, obviously with the borders lifting with Victoria from 12:01 on Tuesday morning, will Victorians coming into South Australia, you were talking about potentially, your usual travel permits, is that still going to be required as well?
In the first instance, we're going to ask people travelling into South Australia to complete the prior approval process. That'll give us an indication as to the volume of people coming in. It also gives us a clear indication of who we need to be looking for if we do have another outbreak. But we'll be assessing whether or not we retain that online application process going forward. So in the very first stages it will still be there, but we'll give further information about that as we make adjustments to how we allow people to come into SA, particularly obviously by road, but also the Adelaide Airport. It's obvious that as we open up to other states and people start to move between SA and Victoria as well as other places, that the volume is going to be a substantial issue for us. And the airport on any given normal day processes thousands of people, and there's going to be a point where we need to work out a way that doesn't unfairly inhibit people coming into South Australia.
Have you already got a rough idea of how many Victorians might be looking to come into South Australia early next week? I mean, I remember at the time you were saying the arrivals from New South Wales when we lifted the restrictions there it was a significant jump. Yeah,
we can't put a number on it, but we certainly anticipate large numbers. I think it's fair to say that the connection between SA and Victoria is probably the strongest as it is with in terms of relationships between the two jurisdictions. So we anticipate there are going to be a lot of people leaving SA knowing that they can return safely, and also people from Victoria coming to visit relatives or undertake business or other activities.
Is that going to be a huge volume to start with, or is that going to jump again when Victoria relaxes its restrictions back the other way?
Yeah, well, we're yet to see what Victoria is doing in relation to their restrictions, although we can say that they don't have a hard border arrangement in place in Victoria. They're doing a mobile roving patrol approach, probably targeting people with South Australian registration plates. We'll talk with our counterparts over there, and as we have further advice about what those restrictions might look like, we'll provide that as well.
In regard to the easing of caps for venues from Tuesday, the Premier mentioned that was dependent on them having a QR reader. Are police going to be enforcing that strictly, or will there be a grace period as there have been with other rules? And who's facilitating making sure these businesses do have a QR reader?
There'll be a communications package which will go out, which will clearly explain to people how they access it. It'll be very simple. People who have a COVID safe plan now will be required to update their COVID safe plan, but that will be emailed to them, and it will include the QR reader, a QR code. We are requiring businesses to produce that QR code on their premises so people coming into the premises can actually participate. It's a very simple process, and what we've seen previously with COVID marshals and other measures we put in place, there's a very rapid uptake. So our expectation is people get on board. Some of the restrictions being relaxed are contingent on businesses obtaining the QR code. So there's an opportunity for them to expand their patronage, but they need to help us by doing this, and we'll work with the community again. But we're expecting a significant take-up very quickly.
So will you be hard on it on Tuesday though?
Beg your pardon?
Will you be strictly enforcing it from Tuesday?
We'll take the same approach as we have with everything. We will work with businesses that are trying to do the right thing, and we'll help them do that.
Commissioner, you've said a number of times that DPC will hold the data, police won't be able to access it. We've heard that, but I suppose what's the structure around that? With the COVID Safe Act, that was legislated that it couldn't be used for other purposes. What are the guarantees apart from your word?
The entire process has been designed so that the information collected as you scan into a premises is automatically encrypted, and it's sent directly to the Department for Premier and Cabinet's ICT area. We have no access to that. We are not permitted to access it. There's no legislation, but the practices that have been developed will prohibit us from accessing that data. It will be exclusively for SA Health's contact tracing purposes, and after a 28-day period the information will be dumped. The venues that are using the QR code that you check into won't have access to the data, so you won't get spam mail about opportunities or functions or sales, anything like that. It will simply be for SA Health purposes. We had a demonstration of the QR reader app this morning at the Transition Committee. It is very straightforward, it is very simple. Once again, I think we're going to see a massive take-up right across the wider community as people realise just how easy it is, and the fact that this is probably one of the greatest weapons we have to dealing with a future outbreak.
Is there a
Will the
sunset
police-
clause
will
for
the
the use of the
police-
QR codes once the pandemic's over, or are they going to continue to be a part of South Australian society forever?
Well-
Is there a set limit or
The use of QR codes and the obligation for businesses to have it is tied to the declaration under the Emergency Management Act. So once that declaration is revoked, the obligation to use QR codes and scan into a premises will also cease. Whether or not there's an opportunity for businesses to continue doing it, or whether we see this as a community benefit going forward for other health reasons, that's not something I would be in a position to comment on. But it is tied to the declaration under the Act.
Commissioner, do you know if the general police search warrant would apply to getting access to the data for a DPC?
We won't be permitted to use it. There won't be a purpose for it, and I can assure people that we won't be using any warrants to access the data.
Commissioner,
we
what
legislate?
businesses need a QR code?
Okay, so
Or
every
what
business.
types of industries?
The directions currently mandate a set of businesses that are required to keep contact tracing records. So the QR reader will be required by those businesses. It will essentially involve any business that downloads a COVID safe plan to access their QR code and push that through their premises so people can access it as they come in. And we are looking at expanding it to other types of services that involves patrons going onto premises to make sure that we're giving our contact tracers every opportunity to get on top of an outbreak if we have a future one.
And it will be it's mandatory?
It will be mandatory for certain businesses, and it will be based on the COVID safe plans in the first instance.
Commissioner, do you foresee any issues with enforcement with regards to having multiple density limits within potentially one venue? For example, a beer garden at a licensed premises being able to have one person per 2 square metres and inside only having one per 4. Could there be some issues around that?
Oh, look, potentially there could be, but our experience and my observations over the last 8 or 9 months has been that businesses are really keen to do the right thing. They're on top of what their business can do. They're happy to ask questions, and when we do inspect premises and find non-compliance, there's invariably been a serious endeavour to get things right. So we'll continue to do that, and you know, we're looking at a 2-week period here, so we're trying to free things up as much as possible, knowing that SA Health still have grave concerns about the potential of this Parafield cluster to keep moving through the community. We'll do our bit to make sure that doesn't
And
happen.
just on that, is that therefore the goal of yourself and the transition committee, that come, say, December 14, we get back to where we were mid-November with regards to caps and limits and the like?
That is clearly the goal. We didn't envisage that we'd be taking these sort of mid-steps today. We were hopeful that we'd be announcing for 1 December going back to where we were prior to mid-November, but I think this is a prudent, balanced approach that ensures public safety from a health perspective. We have enforceable conditions we're putting on the community, and once again we're asking the community to do as much as they can over the next 2 or 3 week period to help us eliminate this particular cluster and get back to where we want to be prior to Christmas, and encourage people to start making those plans for Christmas, because we're hopeful that the process we have in place will get us where we want to be.
Commissioner, could I ask you a two-pronged question on compliance? Firstly, the wider community compliance in those 2 weeks, what's your thoughts on that? And have you had any compliance issues related to Woodville High School or the Woodville Pizza Bar?
Firstly, with Woodville High School, Woodville Pizza Bar, those people who are in quarantine overwhelmingly are doing the right thing. I think, generally speaking, the broader community understands the potential risk associated with the Parafield cluster, and that includes the Woodville Pizza Bar. Also with the high school, everyone that's in quarantine is doing exceptionally well. It is a hardship. People have responded quickly, and they're trying to do the right thing. More generally speaking, I've said this time and time again, we continue to see strong evidence of the wider community complying with the restrictions that we put in place, and those people who are supposed to be quarantining invariably are trying to do the right thing.
You said yesterday that an update would be given at the end of this week or early next week in regards to the investigation about the Woodville Pizza Bar case. Can you give any further update today?
I'll stick by that. The team is still working on it, depending on how you read the calendar. Sunday's the end of the week. But we are working to provide you an update and probably the outcome of the inquiry within a matter of days.
Thank you.
Thanks.
you don't mind. Do you think there could be some people in the hospitality sector who might be disappointed by today's announcements, particularly around the restrictions to 1 per 4 square metres inside venues?
Look, we are acting on the very clear expert health advice with regards to our restrictions. I think most people will be very pleased that we are lifting gradually those restrictions, which will get people back to work in South Australia. I've also got an update that we've already paid out $19.4 million in that additional cash payment to small businesses in South Australia since we announced it, I think, only 3 weeks ago. So there is still significant support going out to this sector. I think the vast majority of South Australians will see very clearly that we are lifting those restrictions gradually and carefully so that we don't have a second wave in our state.
Business SA says only 35% of businesses here actually qualify for that help. So are you looking at changing the criteria so that more people can benefit?
Well, when you say 35% of people qualify, there are many businesses which continue to do extraordinarily well even through this pandemic. So this was never designed to be a support for every single business in the state. It was designed to assist those businesses who still qualify for JobKeeper. And as we announced earlier this week, we're now extending the time frame to apply for this. So if there are some businesses who have been adversely affected, and that means that they can now qualify for that JobKeeper, they can apply for this money right through to the end of February, whereas previously it was just the 15th of December.
But there are some that don't qualify because they haven't been open for a year. I mean, the initial criteria for JobKeeper was
just
quite
to be clear
strict.
on that, it wasn't, and they did put some transition arrangements in because for the point, the example that you give, some people would have started after or after that 12-month period, and so they did have some transitional arrangements in place.
So they now should be applying for JobKeeper?
I don't know which businesses you're talking about originally, but you were stating that some businesses couldn't apply for it because they hadn't operated for 12 months, and there was a ruling made by the federal government that they would put some arrangements in place for those businesses that couldn't qualify to compare with results 12 months earlier if they weren't operating. So they put those transitional arrangements in place.
Speaking with Victoria about returning the favour and removing restrictions for South Australians moving back the other way, and how soon is that going to be the case?
Well, every state needs to make their own decisions upon what their restrictions are going to be, but what they've seen in South Australia, I think, is a textbook response to what has occurred. A very nasty cluster, a very fast-moving cluster, cooperation of the people of South Australia with record testing, excellent contact tracing, a pause to make sure that we could get on top of this, and now we're getting some good results. We're not out of the woods yet. We want to keep a level of restrictions in place, but I think this should give other jurisdictions around the country great confidence in our public health administration in South Australia, and that should lead to a lifting of those restrictions earlier in other jurisdictions.
Yeah, we heard yesterday that the Health Minister hadn't read or been briefed on the Victorian Hotel Quarantine Inquiry. Have you read it? Have you been briefed on it?
Yes.
You've read it yourself?
Yes.
What did you make of those recommendations?
Well, first of all, can I just say the Coates review is really an interim report, so we are all waiting for the final report, but there are some important things which are mentioned in that interim report. Interestingly, though, it doesn't make any recommendations or comments regarding mandatory 7-day testing, which is something that we've already implemented here in South Australia.
Do you think the Health Minister should have been briefed on it?
Well, as I said, it was only an interim report. We're certainly looking at a range of pieces of information and reviews and investigations that occur not only around Australia but right around the world. I made that point earlier this week that we are getting information from every single jurisdiction, but we do wait for that final report and recommendation that is coming. Interestingly, in that report, it talks also about home-based quarantine for returning international travellers. So we don't take a report that goes and is written for another jurisdiction and just adopt its recommendations, especially when it's only in an interim arrangement.
I think it came out on the 6th of November. When
Correct.
did you have a chance to read it?
No, I don't recall.
Was it before yesterday?
Yes, yeah. We look, can I tell you, we all get a huge amount of information which comes across our desk. We get also plenty of advice from people in the general public and even sometimes from the media, and we take all of that on board. But we're very clear in South Australia. We take our expert health advice from the Chief Public Health Officer and SA Health more broadly. They have kept South Australia safe. They've kept our economy strong in South Australia, and I expect that to continue into the future.
We've asked the PM for an extension
Yes.
on the ban for international travellers till December the 7th. Do you expect to have our secure facility in place and operational by then?
So the decision to extend that was on the advice of SA Health, and so they take everything into account, not just facilities that we've got, but also what our projected potential maximum capacity should be, so that we can allow for, if there was a further deterioration in the situation, then we may need to move people from South Australia into the hotel quarantine arrangements. So all of those things are taken into account. I said yesterday that we are 100% committed to the repatriation of Australian citizens who are stranded overseas. We need to play our part in that. We were hopeful that this could occur from the 1st of December, but the advice that we've received from SA Health is to push that out and to resume on the 7th of December.
But will that secure facility be in place by the 7th of December? Is this
I
going
don't have an update on that. I know that SA Health are working as quickly as possible to identify the very best ongoing site for that new arrangement. And again, I think that this will be a good step forward, but we take a range of factors into account. We do have multiple quarantine hotel sites in South Australia, so it could be that in the interim one of those is used to consolidate those infected patients.
Just with regards to international arrivals, do you expect the Prime Minister to accept your request to defer for another week? And what would that mean for any international flights that were due to come into Adelaide next week?
Yeah, look, we know this is a heartbreaking situation for many South Australians who are eagerly looking forward to their brothers, their sisters, their mum, dads coming back to South Australia. But our primary responsibility is to look after the health, safety and welfare of all South Australians. We've received this expert health advice and we're acting on it promptly.
Premier, do you now support, or do you support calls for an independent inquiry into the Medi-Hotel program once we're past the cluster? And
I think we've probably discussed this at length all week, and my position hasn't changed on this at all, Andrew.
That position being that there'll be an investigation over for the whole emergency?
Correct.
Thanks, Dr.
Thank you.
Can we just have a word to the Minister, please?
We're going to get going, guys.
Can we have a word to the Minister, please, Ashton?
We've got to get going.